Hello. You're with me now because you're a dental professional who's at a crossroads. You're trying to decide maybe how long you'll be able to stay in your profession because you're starting to have few twinges, or you're hearing stories about people who are having a difficult time staying in the profession because of the discomfort, because of the body stresses that we go through every day. And I'm here to kind of put things into perspective because those of you who graduated with an associate's have put a lot of time in. Yes, those who have BS's and beyond have put in more time, but we're going to look at the associate's degree. And how long did it take you to get your hygiene degree? First off, you've got those 2 years of straight through 40 hours a week. Then you had 2 semesters or before that, you had 2 semesters of prerequisites. And to be put on the top consideration on the list, you had to work in the dental profession for a significant amount of time so that when the school looked at you, when the board looked at your application, it would look like you really were committed to the profession and you knew what you were getting into. So that's almost 5 years of prep for your degree. That doesn't count if you go on and get more degrees. So how long do most hygienists stay in the field? Somewhere between 3 to 7 years. Took you 5 years to get here. Maybe you'll make it for 3 to 7. So how do you make those good years? And if you want to, how do you have those stretch out? How do you have longevity in your profession? I've been one of those who has skewed the number of years because I've been working for about 40 years, a little over, and pretty much full time, all the time. So how could I do that and still enjoy what I do? Actually enjoy it more. And that's what I'm here to help you figure out if it's worth it for you or not. So let's look. There are actually 3 causes, 3 catalysts that can wreak havoc on our physical framework at our dental offices. And if you have one of them, you need to look into support. If you have the trifecta, oh boy, you really, really need some help. And at the end of this, I'm going to tell you a little way to get some information about actually where you are. But today we're going to talk about the first issue that we have, and it's the one that most of us look at. It's the physical stress that we go through, the physical parameters of our job. We're in a stressful situation, static stress. We don't move much, yet we use a lot of strength. So our muscles are in constant tension and they don't move. So some of you have seen my example of squeezing your fingers. Just think of your back or your arm and just squeeze and then let go and see if your fingers uncurl easily. Notice if there's resistance. And then you're going to do that again because you have more than one patient during the day. So you're going to squeeze again and then you're going to release. So this is what our muscles do all day long. And so no doubt it is a problem for us. So we have the physical stresses. We have the inability to get to the proper position in our chairs. To get to 11 o'clock, I mean, how many of us have an operatory that we can be comfortable in? Our instruments sometimes are not up to what we would like. Maybe we haven't had time to sharpen them. Maybe we desperately need some new ones. Our caviton breaks. all sorts of things happen during the day that add stress onto our physical body. And how can that show up? Well, that can show up in back pain. That can show up in numbness in our fingers because of the tension in our back, restricts the nerves, makes it hard to feel anything and to work. I mean, we might start even dropping instruments. That can show up in grumpy faces, not smiling as much, not being as pleasant as you'd like to be. And that when that happens, it's not uncommon for people to react back to you in a grumpy-like manner. And there it goes, right? And that's just because of your physical issue that you're having. You may be worried about possibly how long can this go on before I have to take some time off so that I can feel better. And where am I? How much more can I take? And that's what I was mentioning to you earlier. I'd like you to hang on, click the button below. You're going to be connected to a simple survey. You'll find out where you stand, what the possibility of longevity is for you in your profession. So I hope this has opened your eyes that there is help, there is hope for you right now. And if you're not having discomfort, kudos to you. Let's keep it that way. You too can take the survey and find out where you stand. So I'm Sally DeCessory. It's been a pleasure to chat with you today. And don't be a stranger. Bye for now. Hi, welcome back. Last time we talked about the physical issues that we have in our profession, we're talking about the 3 causes of pain. And today we'll be talking about the pace that we have to go through, the pressures of that pace, the pace of seeing patients on a regular basis on time, getting so much done in a specific amount of time, production goals looming over our heads, and understandably so. We put a lot of pressure on ourselves as well, perfection. We want to do it right, and we want our patients to like us, and we don't want to hurt anybody. Yet we want to help them be healthy. So there's a lot of this little dance that we go through that promotes emotional stresses that we go through every day. The effects of that can be devastating. The time constraints don't allow us to get up and move around. They keep us going boom, boom, boom all day. We often joke, do you want lunch or do you want to go to the restroom? Which one do you want? You can't have both. So, that can lead to kidney infections, bladder infections, and a lot of discomfort there. And because of these stresses, we can become forgetful and actually not do all the steps of what we wanted to do. I mean, have you ever been working on somebody and couldn't remember if you'd actually finished the right-hand side? Did I do both, lingual and buccal? And yet you have to look back to see. I mean, I've even asked some of my patients, I remember saying, we did that, right? I flossed there, right? So we get so wrapped up in what we have to accomplish that sometimes we're not present in the moment doing the task. So we'll actually make more work for ourselves, doubling up. If we put our notes in right away, then we don't forget and have to go back. So the stress of getting all that done is so strong on us that it can actually make us more tense. I mean, feel how you feel in your body when you're anxious. Do you get butterflies in your stomach, tension in your back? Just notice, think of something that makes you feel super stressed out. And you might not notice it, but that's what you're doing all day long. So find out how close you are to the breaking point, how much wiggle room you have, so you can have longevity in your profession and treat your patients the way they want to be treated and you want to treat them, and work in a way that brings you joy. Take the survey and find out what's going on with you. This is Sally Decessory, and I look forward to seeing you. Fill out the survey. See you in the next video where we talk about the third reason for stress. Bye for now. Last time we talked about the physical issues that we have in our profession, and we're talking about the 3 causes